Thank you for communications at University Health Services, also known as UHS, at the University of Wisconsin-Madison. I'll be moderating today's panel and helping ensure everyone's questions are heard. We have a lot of information to cover, and we are excited to share our plans with you today. As an alum of UW-Madison, I'm proud to work for my alma mater. As a mother, I can also attest to the care and quality with which our providers meet each student. The health and well-being really are center to all we do. For today, if you have a question you'd like to ask, you can submit it as a comment on this video, and I'll share it with our panelists. I understand that we may not get through all questions, and I encourage you to visit www.smartrestart.wisc.edu and www.uhs.wisc.edu to look for answers to many of your questions. I also want to let you know that this presentation is being captioned and interpreted. Those links are listed in the description window under the video panel on the YouTube page. And now I'll turn it over to today's panelists, starting with our Executive Director of UHS, Jake Baggett.
Thank you, Marlena. Let me echo Marlena's remarks and welcome you to UW-Madison. We're really looking forward to you joining us this fall. University Health Services is the health center on campus where we provide no-cost health and wellness services to your entire student community. As UW continues to navigate the ongoing COVID-19 pandemic, we will adjust and adapt to having students and staff on campus during the pandemic. Our priority, of course, is the health and safety of our community members. We are implementing new processes to keep students healthy and limit the spread of illness. Chancellor Blank and other campus leaders are committed to providing the resources to support this effort, and so we can continue to respond to an ever-changing environment. Despite some changes related to COVID-19, the vast majority of UHS services remain available to students. We understand that you may access UHS in different ways, including in-person visits. Many medical and counseling appointments will be available by phone, but we are available in person if needed. We also have online resources available to students 24/7. Our experienced medical and mental health providers are here for you during this transition, and we hope that you will reach out if you need support. In fact, our mental health providers are seeing clients at 80% of their typical capacity, and we've begun hosting groups and other processing spaces in a secure online environment. Again, we are looking forward to you joining us here on campus.
Thank you, Jake. There are many moving parts to campus during a typical planning time, and I recognize that during this time, there are even more questions. I'd now like to turn it over to Dr. Patrick Kelly, our Interim Medical Director. Dr. Kelly?
Thank you, Marlena. As she said, I'm Dr. Patrick Kelly. I'm a family physician and the Interim Medical Director here at University Health Services. Thank you all for joining us today. We're all anxiously anticipating this fall semester and are working very hard, as Jake mentioned, to try and prepare to keep this campus as safe and healthy as possible. And here at UHS, our mission is to protect, promote, and restore the health and well-being of our campus community, which is essential for student success. Since the onset of this pandemic, we've continued to operate and provide healthcare and are working with our public health partners locally and nationally, as well as our other healthcare partners in order to keep as up to date as possible. There are a few things that I want to take a second to reiterate in terms of what can be done to reduce spread of this virus and keep all of our community members safe. You may be tired of hearing about some of these, but it's important that we continue to wash our hands diligently, maintain physical distance, make sure that we're wearing these face coverings. There's been a lot of uncertainty around this virus, but we are learning and having successes in being able to control and limit the spread of this. And those are a few things that I would ask that all Badgers join me in carrying out. We continue to have providers both on-site and are exploring a lot of options related to virtual healthcare. As Jake mentioned, we've been able to continue operations, and one of our other big projects is getting things set up for providing testing for all of our students and campus community members. I know that there will be a lot of questions about some of this, so I think we can go ahead and get to those. Back to Marlena.
Thank you, Dr. Kelly. And you're right, there's been a lot that we've learned since this came to campus last semester. Our first question coming to us, and for those who are just joining us now, you can submit a question in the YouTube link below. Please feel free to submit your question. Our first question is about testing. I'm going to see if Jake can answer this one. Jake, can you please talk about if students need to get tested before they return to campus?
Thanks, Marlena. Of course, access to regular testing is really important, and while there's not a requirement currently to get tested before you come to campus, we are exploring all the options to be sure that you have the testing support that you need. If you have that ability to do so, we certainly would encourage you to know your status before you come. If not, just know that we will have testing support for you when you arrive on campus. So while it's not a requirement, if you have that capacity or that ability, we certainly would support you in pursuing that, but it's currently not a requirement. We are looking at other ways that we might be able to provide testing support before you arrive.
Thank you, Jake. We have some more questions incoming around the topic of testing. I think that is going to be very popular. It's a large part of what we're going to be doing this fall. I am excited to share that these tests will be at no cost. Can you please talk a little bit about, will every student receive a COVID test? How often will students be required to be tested? Is there a requirement? Could you please speak a little bit to that more, please? Thanks.
Thank you. Right. So first of all, it's our goal and our commitment to make sure that testing is available to anybody who needs that. We do have some very clear expectations, in particular for students who live in the residence halls, that they participate in regular testing. We also will be surveilling our entire community to track on the presence and prevalence of COVID within our space, be sure that what we're doing is having the desired effect. And then most importantly, we will have testing sites on campus that students can, and staff and faculty can take full advantage of and get services same day. And we'll be able to provide those test results very quickly so that the right actions can be taken if necessary, or to reassure those who are having testing done. So it'll be available every day, Monday through Friday for sure. And there will be, again, no cost for those services.
Thank you, Jake. Dr. Kelly, if I can ask you this next question, it is about, it continues to be about tests. If a student tests positive, can you please talk a little bit about the expectations around if they quarantine or isolate?
Yeah, thanks, Marlena. What we're looking for in terms of testing is, certainly anybody who is developing symptoms, we want to make sure that they are able to get tested to identify if they indeed have COVID-19. The current recommendations for those who have COVID-19 is to isolate for 10 days from the onset of symptoms or from the onset of a positive test, should they not have any symptoms. Clearance from isolation would depend on that time duration and then some clinical criteria. Close contacts of any individual who has a positive case of COVID-19 would be recommended to self-quarantine for 14 days. Currently, for students on campus, we are identifying and preparing spaces to allow for that isolation and quarantine to reduce the spread as much as possible. We recognize that this is not going to be possible for all of our community and our contact tracers and clinical staff in conjunction with our public health partners. We'll work together to identify the best opportunities for reducing spread. Thank you.
Thank you, Dr. Kelly. Jake, can you speak a little bit to how we will manage isolation and quarantine for those who do not live in the residence halls?
Certainly. Like any member of the community here in Madison, we're going to be working in collaboration with the Public Health Department here in Madison-Dane County. They are our partners in this response, and we will be supporting them through contact tracing as well as follow-up touch points to be sure that students that are needing to quarantine or isolate in their residences are able to do that effectively and to give them any advice and support that they need. And then also to help them make decisions about when that they've completed their quarantine requirements so they can resume to regular campus activities if that's necessary. We also know that they'll want support for their academic work, and so we know that there's infrastructure in place to help support that as well.
Thank you, Jake. For those of us who have just joined us, you may submit questions in the chat function below. A couple of questions for you, Dr. Kelly, related to living in residence halls. I'm going to give you two questions that are somewhat connected. What happens if an entire wing needs to be isolated and or quarantined, depending upon a test result? And a follow-up about that is, as we think about communal living spaces and the residence halls, can you consider the bathrooms in residence halls safe if they're shared?
Yeah, good questions. In terms of what would happen if there's a positive case in a residence hall, what we would be looking at for quarantine and isolation would be identifying those who are, one, for isolation positive for COVID-19, and then in terms of quarantine, identifying those who have had close contact. That's where the importance of maintaining physical distance from those who are not, within your immediate social circle is important, because and maintaining spaces in places like classrooms and other activities, that means that we wouldn't have to quarantine an entire wing of a dorm. It'll vary from situation to situation in terms of how many people would have to be quarantined, but we wouldn't, we're looking to avoid events where more and more people would need to be quarantined. In terms of the safety of the bathrooms, what we're learning about this virus is that it is spread by close, prolonged contact. And while there is some risk in any shared space, and currently the recommendation in Dane County is that if you're leaving your household, you should be making the assumption that you could be coming in contact with this virus. We're working on ways, with face coverings, making sure good hand sanitizer and options for hand hygiene are available, that students are able to maintain distance, get clean when they are close proximity, and maintain the face covering to further reduce spread.
Thank you, Dr. Kelly. For those of us who are just joining, welcome, thank you. We are doing a town hall about health and safety. We have Executive Director of UHS, Jake Baggett, and Interim Medical Director, Dr. Kelly, with us. A couple of things I just want to reiterate and emphasize is that campus testing will be available for all students, faculty, and staff at no cost. Really want to emphasize the no-cost testing option that we'll have available. And if you have any other questions, please feel free to submit them in the chat below. I do have a question for Jake. Jake, can you speak a little bit to how we are going to enforce face coverings, face masks, and how will we address it if we see students who are not complying?
Thank you, Marlene. Right. And so it's like many parts of the country, Madison-Dane County and the campus have committed to the importance of having a face covering requirement. And so that's being communicated very broadly, will continue to be reiterated. We're working with our faculty and other staff of other units to help reinforce that message, as well as asking students to understand the importance of that and commit to that in the form of a badge or pledge that reminds them of this requirement, as well as other of those health protocols that Patrick or Dr. Kelly spoke to earlier. So we're setting that expectation up. We're normalizing that in all of our messaging, and we'll work with students to make sure that they have the masks that they need. If for some reason they don't have their face covering, we will have some of those available throughout the campus as well to support them.
Thank you, Jake. I am excited that we are going to be providing welcome back kits for students, so we'll be able to provide those face coverings for students. Here's another question for you, Jake. As campus prepares to reopen, will recreation spaces be open? And if so, what will we do to ensure that they remain safe?
Certainly, and we're actually working on those protocols now for reopening recreation facilities. As a matter of fact, we have a brand new facility that we look forward to opening this fall, and we anticipate that students will be able to take advantage of it. Obviously, we are reorganizing our work and our activities to be sure that we can maintain the proper physical distancing requirements and of course the mask and face covering requirements as we talked about earlier. So you will see, of course, contact sports, those kinds of activities obviously can occur under the circumstances, but we're working on a number of other ways that we can engage our student community in healthy physical activity. And so the rec center, the outdoor spaces will be maximized in terms of those opportunities as well.
Thank you, Jake. I personally am excited for those facilities to open. For those of you who've been to UHS, we get to see them out of our window being built, including out of Dr. Kelly's window. So exciting times ahead. I'm going to transition to a couple of testing questions for Dr. Kelly. Again, emphasizing that we will be providing no-cost testing for all faculty, staff, and students. Dr. Kelly, I know you've been doing a couple of COVID tests during your time as a physician on campus and testing with students along the way. Can you talk to us about our campus labs running the tests, and what will campus do to ensure that we can do enough testing?
Yeah, that's a really good question. I think everyone has seen that availability of testing has been a very challenging topic since the start. I'm really excited about the work that's been done, within Wisconsin, within Madison, not only at the UW Health Hospital, but a local lab, Exact Sciences, has really stepped up to add capacity, doing a test that is not really in their wheelhouse. In addition, the veterinary diagnostic lab on campus has, in conjunction with the state lab of hygiene that's also on campus, undergone this monumental feat of trying to get set up with their own certified authorized laboratory to help us meet that demand. And so we've been working with all of these partners to make sure that our students, our community, are able to be prioritized so that we can quickly identify those who are positive for COVID-19 and then identify any of their contacts to quickly reduce spread as much as possible.
Thank you, Dr. Kelly. I am going to keep you on the testing for a little bit longer. Can you please talk to us about how long it takes to get results once you've been tested?
Yeah, and this is something that I'm sure many people have already experienced, can be very variable. One of our aims is to be able to make sure that these tests can turn around in a period of time that allows us to actually do the contact tracing and in an effective, timely manner. I've definitely heard rumors of some labs going 7, 10, 12 days out. Working with the labs that we're working with, there have been periods with Exact Sciences where it has gone out to 5 days, but we are working very hard to get that and have been successful thus far at getting that turnaround time between them and the university hospital and our other lab partners within 24 hours and rarely sometimes 48. And so that is going to be a key part of being able to successfully limit spread for any who may be exposed.
Thank you, Dr. Kelly. I have one more question for you, and then I'm going to give Jake a little bit more time. But Dr. Kelly, can you talk to us about what happens if a student were to test positive? How would we support them medically? Would they come into the clinic? How would we continue to support their medical needs?
Yeah, 10 days is a long time to be in isolation. And so it's not just about supporting them medically, it's about providing a point of contact to be able to support them through that period. At the same time, we also need to be cognizant that the course of this illness, for those who do become moderate or severely ill, that can have a delayed onset. And so it's one of the things that we have been working on with our electronic medical record called Point and Click is a module that'll allow us to connect electronically with patients on a regular basis to send them a survey, just say, how are these things going? How are these symptoms doing? And they would definitely have easy access, and we'd want to be sure to evaluate them if things are not going in the right direction. And that'll also provide us an opportunity to be able to connect them with wellness support from behavioral health and our mental health services colleagues to really, again, contribute to their success here.
Thank you, Dr. Kelly. For those of you who are just joining us, we are doing a town hall related to health and safety. We're joined by Executive Director of UHS, Jake Baggett, and also Dr. Kelly, our Interim Medical Director. Dr. Kelly just mentioned Point and Click, and Point and Click is our electronic health record. For those of you who are already actively enrolled students and staff, you actually already have access to Point and Click. It's through My UHS. If you go to www.uhs.wisc.edu, you'll see a link there for My UHS. Make sure you have your information set up, ready to go, because that's where we're going to be communicating mostly with you. For those who are new incoming students, starting mid-August, you'll have access to My UHS. Great thing about My UHS is where you can get your test results, you can schedule appointments, etc. Jake, I have a question for you. UW-Madison campus is a very dynamic, very busy, very populous campus. Can you please talk about any plans we have in place to encourage physical distancing once more folks come back to campus?
Yeah, that's absolutely part of our overall strategy. Reinforcing the need to maintain that physical distance is just as important as wearing the face coverings and personal hygiene, washing your hands on a regular basis. So all of our facilities where students will gather for classrooms or other activities, have already been reconsidered and redesigned so that physical distancing can be supported while people have in-presence experiences as well. And so that'll be, again, continue to be part of our messaging and our expectations throughout the semester. Again, all the facilities have already been or in the process of being reorganized to support that, so that we be sure that everybody has the space that they need to maintain and honor that commitment to that important health protocol.
Thank you, Jake. As we talk about more people coming to campus, will UW-Madison require out-of-state students to quarantine before they engage on campus?
Thank you for that question, and that's certainly an evolving space. There is currently no travel requirement for quarantine here in Wisconsin. We know that some communities are looking at that very carefully, but we don't. Of course, we do encourage people to limit their exposure to others before they come here. And what's really important is when they get here that they participating in the testing support that's available, as well as to continue to monitor themselves on an ongoing basis. As Dr. Kelly, I think, mentioned earlier, we should assume, all of us, whether we're in Madison or any other part of the country, that when we're out in public, that we may well come into contact with somebody who might be symptomatic. And that's why these other protocols are so important, and that we continue to monitor ourselves.
Thank you, Jake. I think that also emphasizes the importance of us wearing face coverings when in public. Another question for you, Jake. So those who come to our campus, most of them are over the age of 18, which means that their health records are protected by federal and state privacy laws. This is related to a positive test. For those over 18, would their students be notified if they received a positive test?
So because of those laws and those protections that are put in place, that wouldn't be the normal course of events. And so we would certainly communicate directly with the student if they had a positive test result or a negative one as well. They would have that same contact. But in terms of whether they share that information with others, including parents, that's going to be dependent on that student's consent. We certainly encourage our students when they're dealing with healthcare issues to involve family members where it's appropriate and help support them in that case. Also would take advantage of this opportunity to just remind folks that, particularly those that live relatively nearby, if for some reason your student would test positive and would need to be quarantined for a period of time, we certainly would offer them the opportunity to do that from their home community, from your residence, if that lines up with what your interests are and the well-being of your family and members of that. So we also want to make sure that that's an option that people understand if needed, that they would likely be able to take advantage of as well.
Thank you, Jake. A question for Dr. Kelly, and then maybe Jake can help a little bit as well. As we look further into the semester, what are some of the criteria that you will be monitoring to decide if or when we need to close residence halls, we need to potentially go back to all remote instruction?
Yeah. Well, that's not something anybody likes to think about. We need to be prepared. I was really pleased with how swift and decisive our response was in the spring semester, and certainly while we're doing a lot of preparation to make sure we can pull this semester off safely, we're going to be continuing to monitor that situation and adapting as we need to. Some of the mechanisms that are in place for monitoring involve some of those surveillance testing cohorts, as we call them, that Jake discussed earlier, based on the number of people that will be enrolled in some of those studies and based on the testing that we're going to be performing in the residence halls. We will have a pretty good idea, a really good idea of what the prevalence is, how the virus is spreading, how good of a job we're doing of keeping it contained. In terms of what is the threshold for, we need to make a recommendation for going all remote, that's something that is going to have a lot of different different statistics that go into it, and that's something that we're working with our local public health partners, our local hospitals and other health partners and campus members to really best understand. It'll involve things like making sure that the staff and employees of campus are healthy and safe enough to continue working, as well as making sure that our students are not being endangered. So that's a really good question, and it is something that we're continuing to tailor as we better and better understand this virus and how it transmits.
Thank you, Dr. Kelly. You know, COVID is on top of mind for everyone. I'd also like to hear from you as a family physician a little bit more about what students can do for general wellness and prevention as they come to college. You know, in a typical year, that's what you spend a lot of time doing. Just to give a little bit of context, in a typical year, UHS primary care alone sees more than 30,000 patient visits. So we're helping students manage everything from stress to colds to the flu. We will have an active flu shot campaign this year, but can you talk a little bit about what you would suggest, Dr. Kelly, to just general prevention and wellness? Maybe touching a little bit about, you know, tobacco usage, overall wellness, just other tips you'd have for students coming to campus this year.
I love that question because I think that even in a pandemic, as a family physician, that doesn't take away from just how important all of our aspects of health and well-being are. Undoubtedly, a pandemic will influence how that happens, and we need to get creative about ways of supporting those. Some of the things that affect our students are definitely going to continue to affect them. And we are very prepared to be able to help meet their needs. We work very closely with our behavioral health colleagues on, you know, if folks need help with sleep or having trouble sleeping, or the opposite, fatigue, they just feel like they could sleep all the time. You know, there's all the emphasis on COVID, but, you know, we need to be prepared to diagnose and treat strep throat, pneumonias, as Marlena mentioned, being able to prevent influenza and being able to get everyone immunized is a huge priority for us. You know, I want to harken back to one of the things that Jake talked about in terms of the recreation and well-being facilities. You know, they're currently doing some online you know, classes and you know, physically distanced classes that you know, it's going to be important to move, and how we move is going to be a lot different these days. You know, I would definitely encourage folks to check out our UHS Medical Services webpage and you know, explore some of the common things and that may come up and how we can support them.
Thank you, Dr. Kelly. This is definitely not a typical year, nor did we end the year typically. For those of you who are just joining us, UHS, we're doing a town hall related to health. In a typical year, we have last year more than 111,000 patient visits. So UHS is typically quite active, both with our integrated medical, mental health, and prevention services. We really do serve 100% of the campus. And also in any given year, half of students will come see our clinical services as well. So excited to continue to offer our services. They'll look a little bit different. There'll be more telemedicine and telehealth options, but we will be able to continue to see students in person as needed. For those of you who are joining us, please continue to feel free to submit questions in the chat below. I do have a question for Jake. Jake Baggett is the Executive Director of UHS and also Associate Vice Chancellor of Health and Wellbeing. Jake, can you speak a little bit to some of the cleaning protocols that are going to be going on around campus? For example, the question speaks to how will I know that my residence hall areas will be cleaned, classrooms will be cleaned, et cetera?
Sure. And we've focused a lot of time and energy and thought into developing our plans and strategies around the cleaning throughout the campus. I know that our partners in campus housing, university housing, have really doubled down on their protocols to be sure that we're cleaning very, very regularly and ensuring that the space that's provided for our students to live on our community is as safe, if not perhaps safer, than they might find in other places that they might choose to live. So we have a lot of confidence in our protocols that are in place there. And that's also true in our classrooms and other spaces on campus. In addition to that, as a part of our individual responsibilities, each of us will have a responsibility to maintain our personal areas as well. And so there will be disinfectant and cleaning wipes available in the classrooms and other spaces, so the students can take care of their spaces where they're at. And again, because of all the layered protocols that we have in place, we have a high level of confidence in our ability to keep this space as healthy and safe as possible. So I know that we've shifted a lot of our custodial staff to daytime shifts to be sure that we can be responsive when students and our community is most active on campus, so that we can support those maintenance needs throughout the campus.
A question coming up for you, Dr. Kelly. People are wondering how soon might they be able to get in to be seen for their medical needs. I will start by saying that UHS is open during typical business hours, which means that we're not typically open during the nights and weekends. Mental health services does provide a few after-hour services. We do have a 24/7 crisis line and nurse advice line. I recommend you put our phone number into your phone. We have one phone number and then it triages you to other areas. It's 608-265-5600. But Dr. Kelly, can you talk about, moving forward, what do you anticipate in terms of a turnaround time if somebody needs to be seen in medical?
Yeah, that's a great question. In previous semesters, routinely, we'd be able to get students in to be seen within 24 hours, often the same day, almost all the time the same day. That's going to look a little different this semester, but the point of service is going to be pretty much the same. Our goal would be to be able to provide contact with that student. Almost all of our visits are starting with a telemedicine visit. If a provider determines that there's a need for somebody to come in person, that's when the in-person visit will get scheduled. Thus far it's worked pretty well, and we have a nice split of bringing people into the clinic and being able to meet students' needs through telemedicine. The thing that we want to make sure of is that we're not endangering the health wellness of visitors to our clinic and our staff, and that's part of the onus of being able to better control how and when students come in and out of the clinic.
Thank you, Dr. Kelly, and thanks to folks for continuing to submit fantastic questions in the chat. Dr. Kelly, I do have another question for you about the testing process. Can you talk a little bit about which tests we will use? Are we going to be using nasal swabs? Will we be using saliva-based tests? I think there's some questions about what that will look like and potentially feel like.
Yeah, I'll start out with the most important thing about the tests that we're using is that they're accurate. In conversations with our veterinary diagnostic lab, as as well as our state lab of hygiene. The key has always been that it's a quality and FDA authorized test. Right now, what that looks like for campus is a nasal swab or a nasopharyngeal swab. Nasal swab is basically an aggressive nose pick. Not that anybody knows what that's like. And then the nasopharyngeal is the one that people get, understandably anxious about, that goes a little deeper into the nares or the opening of your nose. As we move forward, we're actively pursuing self-collection for the nasal swab. So an individual will be able to collect that themselves, and we have, what we need to do is prove that that's just as sensitive and specific as a clinician collected. We'll always be keeping up with the evidence and recommendations in terms of what tests we're able to use that are of high quality, but also being mindful that we want to make this a convenient and viable option for students when we're encouraging them to get tested so frequently.
Thank you, Dr. Kelly. I really appreciate how you said, most important, they're accurate. We have a question that's come in asking a little bit about mental health that I can speak to. Somebody wondering if we will continue to offer mental health services or if there's need to pursue a community provider. UHS Mental Health Services has continued to provide services through telehealth appointments. Right now, our staff are seeing actually about 80% of a typical time. So we're still engaging with students. That's all done over the telephone or through a secure Zoom link. We're continuing to do processing spaces and groups as well. We have more than 40 mental health providers. For those of you who are interested in seeking mental health services, we encourage you to do so. By doing so, you can request what's called an access appointment. We encourage you to visit www.uhs.wisc.edu. And there you can go to our mental health portion. You can also go to My UHS, which is your electronic health record, and you request what is called an access appointment. That's the first step to seeking mental health services, where you'll speak with a trained clinician for about 20 minutes. They'll learn the best way to coordinate your care. They'll connect you to the proper provider and get you going from there. So yes, we will continue to offer mental health services. We've continued to do so. Our folks remain busy and happy to see you. And we all specialize in this population, so we really hope to continue to see you. So for those of us who are just joining us, we have a little bit of time left. Just hoping that we can recap a little bit. Jake, can you just give a recap again on, for students who test positive, how are we going to care for those students? How will they be looked for across campus, taken care of?
Certainly. So most of the testing that's going to take place is going to be administered through University Health Services here on-campus testing sites or in our other testing protocols. So when a student is identified as positive, in either case, they will be contacted by one of the UHS staff working in collaboration with the Public Health Department here in Madison-Dane County, and in terms of case investigation and contact tracing. And the first goal is to assess how they're doing and learn more about where they're residing and figure out how to support them in that period of time for where isolation would be necessary. Students that live in the community, we will work with them in assessing their environment to see how they can successfully navigate that process in their residence hall or their apartment or house that they're living within, and give them advice to do that. Many do that very, very successfully. Those who have the option of being able to return home safely, we certainly would support that decision as well. And then our students who are residents of our campus facilities, we've actually built in a substantial capacity to support them in facilities here on campus dedicated to supporting somebody who needs to be isolated or quarantined during that period of time. In every case, they'll receive daily contacts from contact tracers and staff at UHS to track on how they're doing and figure out what kind of supports that they might need, and to help them navigate with their symptoms should those develop. So there's a number of ways that we're managing this with layers of support and with our campus and community partners.
Thank you, Jake. You know, our campus and our community are so intricately intertwined. Can you explain a little bit more when you say the local health public department versus UHS? What's the distinction? I mean, I know we're very much linked together, but for those who might not be familiar, can you talk a little bit about that partnership?
Certainly. So the public health department, like every county, has almost every county would have a department that's focused on the public health goals of the communities within that county. Because UHS, because the campus represents such a significant population, in particular here in Madison, it's been important that the UHS and the Public Health Department of Madison-Dane County have an ongoing, effective relationship to track ongoing communicable diseases or other health concerns. And we've got a long history of working in that way. The pandemic, COVID-19 pandemic, has given us another opportunity to really elevate that work. So we take quite seriously what we represent as a part of the campus, a part of the community, and we want to be sure that we've provided the necessary supports to augment or supplement the public health department's mission of contact tracing and public health work. So we're working in a fairly unique but important collaborative way to do that. But public health in Madison-Dane County is a county and city public health department. We're a part of that community, and we're there to work with them to be successful in protecting the health and well-being of our entire community.
Thank you, Jake. And right now, UHS has 6 nurses, I believe, working with public health to work on that contact tracing. Can you speak a little bit more to any additional hiring we might have planned?
Yes, we've actually have an ongoing hiring process. We started very early in the summer and late spring with making sure we had additional staff available to support contact tracing. But we're actively recruiting and then hiring additional staff almost daily to be sure that we have enough capacity to support the campus when students and the staff and faculty return to campus in the fall term. So we have a high level of confidence that we'll be able to respond in a very timely manner. The timeliness of contact tracing is really critical. So we want to be sure that we can live up to that commitment, to be sure that we are protecting our individuals as well as our larger community.
Thank you, Jake. We have time for about 2 final questions before we wrap up. One of the most popular questions coming through is, do we have criteria for closing campus? What does that look like? How will we make a decision? Jake, could you please start with that one?
Sure, thank you. And Dr. Kelly spoke to this a little bit earlier in the presentation, but it is a complex question, and it depends on a number of factors. So we obviously are working very closely with our public health partners here in the community, our healthcare providers, both here in Madison and the surrounding communities, to make sure that there's sufficient capacity to respond if necessary. So that's one of the factors. We're also, tracking the prevalence rates both here locally and here on campus to be sure that we know what's going on, that we can early detect any significant changes in prevalence and respond, hopefully in a preventive way, to mitigate that trajectory. Also what's really important is our ability to support individuals who might need to be quarantined or isolated. So while we are well prepared to support that, we also know that there are limitations to what any institution can do. So, monitoring how we're doing with that is also going to be important. And then there's constant work going on as additional knowledge and understanding of how this virus spreads and in the community. As that knowledge base grows, we continue to update our own thinking and modeling with some experts in this space to be sure that that we know when it is the right time to make the decision about campus operations. We're going into this with a commitment to supporting the health and well-being of our community. That's always going to be our priority. And then we are intentionally planning actually to discontinue on-campus classwork for the most part by Thanksgiving, and support the balance of the semester virtually. So there's a number of factors going into that, and our long range and short-term planning are all reflecting in that effort.
Thank you, Jake. I just want to really emphasize that as a campus, we've already implemented a number of health and safety changes, including mandatory face coverings in all campus spaces, a broad and robust testing program, additional cleaning measures, we're reducing density in classrooms, and more. We're also keeping an eye on this evolving situation, and we'll be prepared to make changes as necessary. We've all seen how much has changed in the past 6 months. It's been quite significant. Let's go to the final question, and then I'll give Dr. Kelly and Jake a chance for some final remarks. Dr. Kelly, can you please talk a little bit about testing? Is it going to be mandatory? Is it going to be available? When can folks start testing?
Yeah, it's certainly popular, as you predicted early on, and with good reason. It's been an essential part of identifying this virus and being able to limit its spread. It's a fairly unprecedented scenario for a virus to spread so frequently with minor or no symptoms. And so the key emphasis still, though, is going to be anybody who has symptoms, and you can go to healthscreen.wisc.edu or link through that from our Smart Restart page to see the list of symptoms. Anybody who has those symptoms should seek testing. Currently in Dane County, our public health partners, as well as the National Guard, have a site set up that you're able to get in and out of. They're testing 2,000 to 3,000, as much as that in a day. Right now, we have some capacity here at our clinic at University Health Services. And we're aiming in the next few weeks to have a site set up on campus for folks to be able to come through. And as we develop more capacity, we'll aim to again meet the needs of our students who, by the time that they're coming to campus. Beyond that, we're testing for students with symptoms. We're really looking to address the needs of some of our students who are in these congregate living settings of the residence halls. And for them, in order to keep that setting as safe as possible, we're looking to test them all around the time of move-in, and then to monitor that space in addition to monitoring the broader campus. And that, from there, we'll be able to make adjustments to our recommendations over time in terms of who is definitely going to benefit most from testing, both from a personal health and wellness as well as from a community public health standpoint.
Thank you, Dr. Kelly. And just emphasizing again that we will be providing no-cost testing for all students, staff, and faculty. We are working on finalizing those spaces. We should have the first one up and running by August 8th or 9th, and then the other place up and running by the end of August. There'll be an established testing location for students who live in the residence halls. Those students are going to be required to get tested every 2 weeks. More information there. Continue to look for information at www.smartrestart.wisc.edu and uhs.wisc.edu for all this information. I am next going to go to Jake for just some closing comments. As Jake comes on, I just want to continue to emphasize that UHS really is here for you. We're here for your continued health and well-being. Jake, any final comments?
Thank you, Marlena. First, I'd just like to thank you and Dr. Kelly for making yourselves available to help with this town hall and share this important information. Then I'd like to also thank those who have taken time to participate and understand more about the work that we're doing and share your questions. All of your questions are important, and hopefully we've answered many of those. All of the work that we're doing is vital. We're using, what are established and demonstrated to be effective protocols and processes. We're thinking very, very carefully about every aspect of the campus and how we can safely operate and provide those experiences. We also know how important it is for students to have, on-campus in-person experiences. And so we're working to endeavor to support that in the safest possible way that can be done. With that in mind, all of that is only effective if each of us do our part as part of the community. So each of us have an individual responsibility to wear our face coverings on a regular basis when we can't be in spaces by ourselves, when we're sharing spaces, or when we cannot maintain physical distancing even outside on campus or within our community. It's important that we wash our hands regularly to just minimize. Those layered strategies can be highly effective in navigating that space. We know that we'll have to adjust periodically throughout the semester to respond to trends and additional knowledge that will be developed. And we'll continue to communicate those expectations with our entire campus community. But it's up to us as individuals to really step up and do our part so that we can contribute to the overall health and well-being of our community. So I ask that you do that, and you also, any of your family members that come to the campus, that you would support them in those same efforts. Thank you.
Thank you so much, Jake. We realized that we received more questions that we could answer in this time period, a lot of fantastic questions, and also there are some answers that we just don't have quite yet. We encourage you to continue to look for your specific questions on the Smart Restart website, the Parent and Family Facebook page, and our Ask Bucky Customer Service Center. We thank you very much for joining us today. We look forward to having you involved and connected to UHS. You can continue to find more information at uhs.wisc.edu. You continue to make appointments and be seen by providers, whether through telehealth, telemedicine, and limited in-person appointments. At this time, I would just like to thank everybody. Jake and Dr. Kelly, if we can just give a final wave to our fantastic folks. Thank you for submitting some fantastic questions. And as always, on Wisconsin.